that's basically and primarily why we have opted for a dedicated server. And then let me also add that we saw it as an opportunity for a backup. Listen, you can't have too many backups for your resources. They can't be too much. If we, like for the main university IR, which I manage, we have a local server for it, which is in the main library. We also have a cloud server for the same resources. What we just do is to do a push and pull synchronization at certain times. When I got to know about this project, and I heard that there will be a server attached to it, I was so happy. Why? Because now it means we have another storage for our medical resources. And these resources can also be replicated on the main university local server. And I can also decide to make available the main university IR on this same server as a backup. So the advantage is, aside the fact that I can work in the main IR within a community to do what I want to do on this, I can also work independently. It's a matter of doing your synchronization at any specified, defined time. So I think that the best option is to have a dedicated server for this. Number one, for backup purpose. Number two, because this project will grow, because this project will involve resource sharing within participating institutions, that you should be able to provide access to the resources on another participating institution. So because this project will grow, and the IR policy for the institution is there, you can have a policy for this project that can allow you house, for example, me housing the job from University of Zambia. Are you getting it? And yet, I will not be violating any law because I'm working within the context of this project. And whatever resource I'm accessing, I should be accessing it from the server dedicated to this project in Zambia. Do you understand, sir? If I have to be accessing it from the main IR of that institution, I don't know what their policy is about access, because we have access policy, we have upload policy, we have policy on different areas of this project. I don't know what specific national policies about that area is, but if it is within this of this project, I'm safe. You are safe. So I think a better option is to have the guest server for it, but also ensure that there's a handshake between all platforms. I had to log in using an IP. The database is installed on the server that was procured basically for this project. Before now, the university has an institutional repository, a very robust one. And what we have done is to make sure that this server is dedicated to this project and is purely for this repository. Now, we have also created a link on the main institutional repository to this, so that from here, you can access what we have on our repository, and from our repository, you can access what you have here. We try to ensure interoperability within the two systems. Now, the server where this is installed has a public IP on it, which is mapped to the URL she displayed earlier. So that from anywhere in the world, anytime you can log in go to that URL, you have access to the ADHL repository. All right. So like she has already said, we have a number of communities already created on it. Faculty of Basic Medical Sciences, and it has sub-communities under it too, like all the departments under all the fields, under that faculty, like anatomy, biochemistry, and all that, has been broken down, and sub-communities have been created. And in all the sub-communities, we have collections created in them. We have collections created in them. So from this side, you can do a search. Let me take malaria, for example. Of course, malaria is endemic in Africa. So if I do a search, it gives me thesis and dissertations on malaria. And from here, I can click on any of them to get a full text. My God, I think the network is quite slow. I want to show you something in the article when it's opened. Now, something that we considered while doing this work is that we looked at the issue of consistency in the presentation of the resources on the IR. We ensured that our communities are precise. The sub-committees handle different areas in medicine, different issues in medicine. And now, we also ensure that all our files are in specified format and all properly watermarked and identified as a product from the university. So by the time you open any LA thesis, it has a watermark saying that this job was done from the University of Ibadan library. It's an output of the University of Ibadan library. And then we also ensure that we have a consistent naming format. We have a consistent content format. Which I talked about optimization the other time. I talked about OCR, the watermarking. Then for the contents that are not supposed to go public, those are supposed to be abstracts alone, we have a format of security for them. We use Adobe Professional to get them secured. This is a project that on the long run will also be the university's project. And then the content that is coming up on this project are contents from this particular contents are contents from the university. So what we did was to ensure that the resources are watermarked because they are thesis and they are going on public. There's a need to also reference or cite the fact that it's a product of the University of Ibadan. So of all our resources, there is a watermark on them. And then the process, the metadata was generated using Dublin core schema. We have a uniform Dublin core elements that we select for all our resources. Dublin core has about 15 simple elements and 3 amplified elements. So those 15 core elements that are repeatable, we picked specific ones that we want to use for this project. So that our metadata settings will be standardized and will be consistent across board. So when you see our metadata template anywhere, you can say, this is University of Ibadan metadata set, for every of our work. And then she talked about the having, when you scan documents done in the, we have some as old as 1949, yes, 1949, 1950, and they were done typewritten and all that. When you scan them, you need special applications to be able to copy them, to do the OCR effectively well, and then to make them presentable. Some of them there are some of them that the papers had, the paper was bristling already. Some became very old and all that. For those, what we also do before we bring them to this level is that we edit, we bring them into probably Photoshop or Micromedia Fireworks to clean up the dent, to ensure that they are readable, they are clean. And that's why this work, some of them are very old, but yet when you see them, they come out very clean. It's because we have taken time to ensure that the digitization process is religiously followed according to our set standard. According to our set standard before the final presentation. And that's why we can always take responsibility of whatever you see on the IR, because you know that it's a product of a thorough process.